Ear infections are one of the most common infections we see in the doctor's office. It can affect kids and adults alike. But it's not something that you always need to go to the doctor for. In this video, we're going to review some simple things that you can do at home to get through one. Welcome to Family Med, your medical home for practical and accurate information to help your family make healthy decisions. I'm Dr. Earache Richardson. My passion is helping you cut through all the health information clutter on the internet. If that sounds like the kind of information you or your family needs, make sure you follow along with us. Hit that subscribe button and share it with your friends. Okay, so today we're going to be going through what you can do at home to alleviate and help you or your child through that ear infection. For a better discussion on what the different symptoms of an ear infection are and when you should go to the doctor, make sure you click up here and get some great concise information to help you decide what to do. Now, when we talk about treatment, it's important to understand that there are two main types of infections that we see. One is bacterial and one is viral. I don't want to get into too much doctor lingo, but it's important to understand the difference because there are very different ways in which you may treat it. When an ear has a bacterial infection, we call it Acute Otitis Media. These are a lot less common. The second type we call is Otitis Media with Effusion. These tend to be viral. Now, the names don't mean a whole lot to you. All you care about is your kid's ear is killing them. But it makes a big difference to your doctor. Because depending on what the eardrum looks like, gives us a good idea of which is which. Ultimately, it matters because there are significantly different treatment approaches that we take for each of them. So why does this matter? Well, it's important to know because antibiotics are worthless in treating a virus. If the eardrum is red and bulging out at you, then it's more likely to be a bacterial infection and may benefit from an antibiotic. Now, if the ear is just red and angry looking, but not bulging out, then it's more likely to be a virus, and the antibiotic would be worthless. So, red and bulging likely needs an antibiotic. Just a red eardrum likely doesn't. I'm not going to go into depth today about the dangers of overusing antibiotics. Maybe I'll address that in another video. But the short of it is, the more we use antibiotics unnecessarily, the less they're going to work when we really need them. Unfortunately, ear infections are one of the leading reasons for unnecessary use of antibiotics. So hopefully watching this video will help you be a little better educated as you speak to your doctor on your options for treating this. Unfortunately for you, the patient, there really isn't a way to know what you or your child have without an exam. So does that mean that you need to run to the doctor or emergency room every time your kid complains of an ear pain? Well, thank goodness the answer is no. So again, refer to my other video about when you should be seen for an ear infection. So, what are some things that you can do at home to help you through this? It's important to remember that since most ear infections are caused by a virus, your body will often clear it on its own. Because of that, most of our treatments will focus on helping with the symptoms, while your body does what it does best, and that's fight off the infection on its own. So the most effective thing that you can start with controlling the symptoms are simply taking some of the over-the-counter pain relievers, like ibuprofen or Tylenol. Both can be very effective in controlling the pain and symptoms related to an ear infection. Just follow those dosing instructions on the bottle. Now, some of you may not know this, but often we can get better relief by alternating both medications. You may want to talk to your doctor about this, but to my patients, I'll often recommend taking each one every 6 hours. But that means that if you stagger them, you can alternate taking one every 3 hours. Taking something more consistently usually gives pretty good pain control and will control your symptoms better. The next thing that can provide some relief is using a warm compress or heating pad and alternating that with cold compress or ice. Now be careful not to leave heating pads on for a long time, but applying heat to the area can oftentimes provide some relief. You can then alternate this with a cold pack or ice to help control the pain and symptoms related to the infection. So those are a couple things that we know work through different studies, but there are plenty of things that are done and used that can provide some relief that may not be quite as studied. So here are a few simple ideas that you can help. Well, one thing you can do is have your child sleep with the affected ear up. We can use gravity to help relieve some of that pressure. Also, you can apply some gentle downward and outward traction on the earlobes while they're laying on their back. This won't cure the infection, but it can help relieve some of the built-up pressure. Also, some other things that many people may advocate for are putting in things like garlic oil, tea tree oil, ginger, or olive oil in the ear. A few drops of body temperature oil in the ear can provide some relief. I wouldn't count on it necessarily to cure a true bacterial infection, but it won't hurt and can provide some relief. And although there aren't any great studies showing that these things are effective, they aren't felt to be harmful. Now, there are plenty of people out there that are going to swear by them, but remember, most ear infections are caused by a virus and will get better on their own anyway. So just because you didn't go to the doctor and get an antibiotic and it got better, doesn't necessarily mean that it was from these treatments. The only caution that I would give you in trying some of these alternatives is if there's drainage coming from the ear, I'd recommend getting that checked out before you start putting things in there. If you have a ruptured eardrum, you don't want to be putting drops in there. A couple things that I do recommend against, and these are ear candles and even worse, fire cones. This is where you use a candle in the ear or a rolled up piece of newspaper in the ear and light it on fire. This has been looked at and it is not shown to be effective and really can be quite dangerous, so just don't do it. The most important thing to remember about any of the home remedies is that your symptoms persist or are getting worse after a couple of days, that go in and get seen. Now, the last thing I want to talk about, and is maybe the most important, what are some of the things that you can do to prevent your kids from getting them in the first place? Here's a few things that I suggest. First is, get your kids vaccinated for both flu and pneumonia, as well as the bacteria Haemophilus influenza. Now, these are standard common childhood immunizations. Also, wash your hands and teach your kids to wash their hands frequently, just to prevent you from getting sick in the first place. As well, get rid of the constant use of a pacifier. In one study, it showed that the elimination of a pacifier use decreased ear infections by 1/3. Also, don't give infants bottles to sleep with. Besides dental problems, it also increases the risk for ear infections. You do need to stop smoking. Smoke exposure for your kids also increases the risk of ear infections. Now as well, make sure you breastfeed your baby for at least 6 months, preferably for a year if you can. Well, that's about all I wanted to share today about ear infections. But before I go, I want you to remember these 3 simple take-home points. First, most ear infections are viral and don't need to be treated. Second, try and control the symptoms, and if that doesn't work, or the symptoms persist for a few days, then go to the doctor. And finally, remember to take those steps that we just reviewed to prevent ear infections from happening in the first place. So there you have it. Hopefully you've learned something today about ear infections and now feel more comfortable about how to deal with them. Remember, check out the notes below to review the things that we have just talked about. Also, I want you to go ahead and comment below as well. What are your experiences with ear infections? What things have you found to be helpful? Are there things that you have found to be useful that we have not discussed yet? There are certainly a lot of things out there that can be helpful, so let us know what you think. Okay, so if you find this information to be useful, don't forget to like, subscribe, and share this video with your friends. And check out our other videos on this channel. This is key to me being able to continue to create this kind of content for you. And remember, my purpose in sharing this information for you is to educate you in the things that you can think about in trying to make decisions in your own health. In no way should it be taken as direct medical advice to you in your own situation. So please, consult with your own doctor for concerns regarding your specific situation. So until next time, this is Family Med with Dr. Richardson. And remember, please take care of your body, because it's the only one you have.